If you are watching our show this morning and you or someone you know is dealing with shoulder pain, knee pain, you know how debilitating it can be. Chronic everyday pain totally can influence in a negative way the quality of your life. So we're so happy this morning to have Dr. Brett Sanders join us. He, of course, is with the Center for Sports Medicine. Good to see you.
Good to see you. Thanks for having me.
I will confess to you completely, I was a little bit surprised when you and I were talking about what you might want to focus on this morning, and you were telling me knee and shoulder pain. I was expecting you to talk about replacements. You can do that, but at Center for Sports Medicine, you're doing a lot with, as you say, biologics.
That's right. Yeah, there's a lot of very interesting new developments that are coming out, frankly, quicker than they can be vetted. You know, they're coming from the lab to the bedside, and it's a very exciting time. So there's a lot of emerging technologies and techniques that we have now that add to our ability to treat traditionally surgical problems or problems that would end up getting, a metal joint. Basically, we have more options now where we can try to prevent or delay that, or sometimes just eliminate the pain altogether.
Well, I'm interested in the way you phrase something, because you said there are more options, if you will, coming out than can be vetted. So I guess, you're having to always be on the forefront of the newest things that are out there, but that is what you're doing, is you're finding out for yourself what you see to be beneficial versus what promises to be beneficial.
Yeah, what we've done at the center is a gradual introduction and, very cautious, safety and efficacy oriented. And so it's a lot of training and work to ease through the various options because there are so many options coming out, and the science is changing so fast. What was true a month ago may not be true, next month. So we're really staying on top of that, and we've developed a more biological approach. And so now we have a lot more in our armamentarium to help fix joints with natural biology or try to heal. A lot of this is aging and cell senescence, or aging of cells, or the immune system not responding properly to arthritis. And some of this can be altered with various biologics approach that are in many cases naturally obtained from the patient themselves, or in other cases sometimes manufactured by a company or harvested from a biologic company and then injected into the patient. So this is bridging a huge gap between metal joint on one hand and sort of cortisone shots on the other, which used to be the only option, and that has its own downside as well.
Well, sometimes I'm sure you do find yourself with some patients and you're trying to choose the lesser of two evils in a way, if you will, because if you are living with chronic pain, if you've never dealt with that, you can't understand how horrible it can be to have that, as most people call it, the bone-on-bone feeling. So do you just kind of counsel with your patients, and does some want to go ahead and give like the stem cell or the PRP a go to avoid the possible negative benefits of surgery?
Yeah, there's an individual discussion with each patient, and like you said, if you come in and you're bone on bone, that's pretty advanced, and it's difficult to support scientifically that really any of these treatments are going to grow cartilage in that situation. Now that's happening in the lab, but your knee's not a lab, and the FDA won't let us apply things that they are applying in labs. So it's very exciting, but we don't want you to come in, too late. Or if you do, we can handle that too traditionally. But where I like to begin this discussion is where we have a lot more options, where the cartilage is still mostly present. And we can influence the immune system predominantly, or the inflammatory response to the early cartilage breakdown. That's the best time to utilize these things, because these things cost money and their time, and we want them to work. So you want to come in where you have your best chance of working and not too late where, the odds kind of go down. So there's a bit of a window there where we want to start that discussion.
Yeah. So while I've still got you, let me ask you too about rotator cuffs. I think I mentioned elbow earlier, and I meant to say shoulder. Is it true that rotator cuff surgery is perhaps one of the most grueling surgeries a person will undertake?
Good question. That is a commonly held notion on the street, if you will. In large part, I think, because of some of the older techniques or paradigms for treatment. 10 or 20 years ago, there's still a lot of people walking around that had a pretty negative experience with that. In large part, I think that was due to inadequate early treatment. So similar to what we were talking about with the knee, if you let your rotator cuff become irreparable, where the cuff is dead basically, and then you try to fix that later, it's not going to work. It's too late. That doesn't mean the surgery doesn't work. When you fix them earlier, when they're smaller, they do great. And there's also been a lot of advances in terms of nerve blocks, arthroscopic surgery, and other techniques with releases and various other ways to fix the cuff that are turning out to be much less painful. Like, for instance, I do a method where we try to avoid foreign material or hardware that's in the shoulder and repair it sort of more naturally with just suture. And that tends to have a lot less pain. And so what we're seeing is a big reduction in pain. So, it used to be sort of, maybe a large percentage, 80% of people would have pretty significant pain, and now it's the other way. It's 80 or 90% of people have very little pain, almost to the point where we have to kind of caution them not to go too fast these days. It is always possible to have pain with the cuff, but in my opinion, that's mostly due to what you walk in the office with. If you walk in the office with a 10-year-old tear that's retracted and it's a rusty spring, when we pull that rusty spring out, it's going to hurt a lot more. If you fall off a ladder and come in the next week and we fix that, that's going to heal well and be fine. Well,
you may have just changed the word on the street this morning. Who knows?
Well, we try.
So let me ask you this then before I let you run and see your patients. I know it's the Center for Sports Medicine. That does not mean that you have to be an athlete to come in. So you've got lots of locations around the viewing area. Do people just call the main number and find the location closest to them?
Yeah, that's right. The main number will generally put you closer to where you are anyway, just for convenience. Cleveland, Fordo, downtown, Nixon. Exactly. They'll figure it out.
And the early bird gets the worm in this case. You don't want to wait until the pain gets to a point where you can't stand it.
Yes, I think that's, true in life, and it's true in medicine too. We don't want to let small problems become big problems because they're harder to solve.
Well, always good to talk to you this morning, Dr. Sanders. Thank you for finding some time.
Sure, you're very welcome. Thank you.
You can contact Dr. Sanders and the other staff there at the Center for Sports Medicine, the main office, as he said, on Macaulay Avenue. That number is 423-624-2696. When you call them, they'll find out where you are in town, and they'll help you find the location closest to you. Online, it's sportmed.com. We're back after this.